I'm Sherry Boschert reporting for IMNG Medical Media at the annual meeting of the American College of Physicians. Dr. Matthew Spitzer did a randomized study, looking at adding testosterone to sildenafil. Why did you do this study?
Well, we did this study because testosterone is widely viewed by many individuals to be an important regulator of sexual function, but the role of testosterone therapy in erectile dysfunction in general is rather controversial, with many expert societies making different recommendations. So we tried to figure out how efficacious testosterone therapy is when added on to sildenafil, a first-line therapy for erectile dysfunction.
How did you do your study?
Okay, this was a double-blind, randomized, placebo-controlled trial in which men with erectile dysfunction and low testosterone were randomized to either sildenafil with testosterone gel therapy or sildenafil with placebo, and we contrasted their sexual function scores over a 14-week period.
How many patients in each group?
There were 70 in each group, and we were mainly looking at, as our primary outcome, the change in the erectile function domain of the International Index of Erectile Function. We found that adding testosterone to sildenafil did not increase erectile function above and beyond placebo. We noted that there was consistent absence of a difference for every measure of sexual function. Frequency of sexual encounters, satisfactory sexual encounters, sexual desire. All of these did not differ between groups. Quality of life, vitality. So we concluded that adding testosterone to sildenafil did not yield any additional benefit.
Has this changed practice at your institution at all?
Well, yes, my colleagues have come up to me since then, and one of the things we're doing more often is when we find someone with a low testosterone level and erectile dysfunction, we try sildenafil first, and we see if that works. Most of the time, we find great improvement, and some of the time, testosterone levels bump up as well. So there may be some relationship there.
Is this popular, adding testosterone to sildenafil? I mean, I know there's controversy in the guidelines, but is it happening out there?
Yes, it's a very common practice. Testosterone use is soaring in the United States, and people use this with and without selective phosphodiesterase 5 inhibitors. The testosterone, the number of prescriptions used in 2011 is $1.6 billion. So it's a huge deal. It's a immensely important issue.